Hello friends, welcome back to Complete Medical Coding. Today I'm here with some details about AAPC. Okay, all about AAPC. This chapter is mainly for the coding beginners. Okay, those who are into the beginner level in coding, or those who want to make their career into coding. All right, so let's learn in detail about coding and AAPC today. Okay. What is AAPC? What is the full form of AAPC? Everybody knows AAPC, CPC, all those things, but you should also know the full form as well. Okay. What is AAPC? American Association of Professional Coders. Okay, that's the full form. American Association of Professional Coders. This comes under American membership. Okay, there is a membership in AAPC for those who are taking or who are going the career, making the career into AAPC, into the those who want to make their career into coding. You should initially pass the basic examination from AAPC and you should take a membership as well, which should be maintained. Okay, let's come into that in the further slides. So AAPC is American Association of Professional Coders. It's a professional organization focused on the business side of healthcare. Of course, it's a business side. It provides education, certifications, continuing education, resources and professional networking. Okay, there are many certifications, there are continuing education, everything we will discuss one by one. And AAPC is established in 1988. Why AAPC matters? Yeah, this is what I was telling before. Why AAPC? AAPC consists of which courses, which all courses, or what does it focus on? This mainly focuses on medical billing, medical coding, medical billing, medical auditing, healthcare compliance, clinical documentation, risk adjustment, practice management, and revenue cycle management. All right. Okay, so these are the topics which will be covered under AAPC, or these are the certifications that comes under AAPC. Okay. From that, the basic coding is CPC. As you all know, CPC is the basic coding level. Okay. What is CPC? CPC means Certified Professional Coder. The full form is Certified Professional Coder, and it is one of AAPC's most recognized credentials. Most recognized and the basic credentials of coding. It is primarily focused on professional or physician and outpatient coding. CPC is mainly outpatient. Outpatient as well as inpatient is also there, but the basic level, okay, of CPC. CPC is the basic level. Now, it requires understanding of documentation, ICD-10-CM, CPT, HCPCS, guidelines and modifiers. All those topics will be covered under CPC. How the documents, how we can identify the medical necessity from the documentation, how to code as with respect to the medical necessity, then diagnosis, procedures, everything, modifiers, HCPCS, everything will be covered under AAPC coding. Okay. Now, which are the major AAPC certifications? These are the major AAPC certifications. CPC, Certified Professional Coder, which is the basic thing as I told you earlier. COC, Certified Outpatient Coder. CIC, Certified Inpatient Coder. CPB, Certified Professional Biller. CPMA, which comes under auditing level, Certified Professional Medical Auditor. CRC, Certified Risk Adjustment Coder. CPCO, Certified Professional Compliance Officer. CPPM, Certified Physician Practice Manager. These are the common certifications under AAPC, but apart from this, there are many certifications as well. If you log into AAPC or if you check the AAPC website, you will come to know. Okay, you will come to know that which are the certifications or the courses that covered under AAPC. Okay, I'll share you the AAPC link at the end of this slide. All right, those who are into sorry, those who are new to the coding, they must not be knowing what is AAPC, how to log into AAPC and everything. So I'll be putting that website, that URL, that link. Okay. Okay. So AAPC membership. How to take AAPC membership? What is AAPC? How to take that membership? Okay, or what does it consist of? So AAPC membership supports professional development. These benefits can include continued education (CEU), continuing education units, coding resources, networking, educational programs, conferences and webinars, professional community. So what is the purpose of taking a membership? When you take a membership, you will get all these benefits. Okay, you can gain CEUs from that. You can attend webinars, seminars, conferences. Then you will get a chain of networking. Then some other educational programs. Everything will be you will gain from the AAPC when you take the AAPC membership. What does the CEU mean? What are CEUs? CEU means continuing education unit. Okay, certified professionals must maintain their knowledge through continuing education. AAPC currently requires 36 CEUs every 2 years for one certification. Requirements increase with the multiple certifications. So this means every 2 years you have to gain 36 CEUs in order to renew your membership. Okay, once you take the membership, once you are into the AAPC membership, every 2 years you have to gain 36 CEUs, which can be gained freely through AAPC website, through the webinars, the seminars, the when you attend workshops, conferences through AAPC, you will definitely gain 1.5, 2, like that, each CEUs. There are paid CEUs as well, but you can get free CEUs also. And there are questions, like monthly questions. If you attend those questions, you will get a the CEU. So these are like that. Okay. What books do coders use? Coders use, if you, for example, if you are doing CPC, what all books is needed? As you know, it is, there are 3 books basically. CPT, that is for procedures and professional services. ICD-10 CM for diagnosis, okay, diagnosis, diseases, symptoms and conditions. HCPCS level 2 for supplies, drugs, DME and other services or products. So these 3 books are needed. Coding also requires official guidelines and pair specific rules. Yeah, coding does not mean you should not fully depend on these 3 books, but there are specific guidelines and pair specific roles. It depends on the area where you work. Okay. Now, coding is more than memorizing codes. Coding is more than memorizing codes. Means here in the coding, you don't have to memorize any codes. You can always use, even in the examination, you can use the you can refer the books. Even for your career, when you go for a job, you can definitely use your books. Okay, so it doesn't mean, coding doesn't mean you have to memorize the code. No. First, you have to understand the documentation. See, documentation, understand the record. Then diagnosis, select the appropriate ICD code. Procedure and services, select the appropriate CPT HCPCS. Apply the coding rules, which comes under guidelines. Okay, apply the basic coding rules. Modifiers, report when supported. Whenever it is needed, you have to add modifiers. Medical necessity, verify the support. Then claim, submit accurately. So that's how you have to do the coding, not memorizing codes. Now, what should a beginner study? A beginner should study what all things? These 10 things the beginner should learn. Medical terminology, anatomy and physiology, pathophysiology, ICD-10 CM, CPT, HICPICS level 2, modifiers, coding guidelines, medical necessity, and practice cases. These are the things a beginner should learn. Now, which certification should you choose? It totally depends on you. Physician clinical coding. If you are mainly focusing on physician clinical coding, go for CPC. If it's only outpatient hospital coding, go only for COC. If you need inpatient hospital coding, go for CIC. Medical billing, CPB. Auditing. For auditing, you have to learn CPMA. Risk adjustment, HCC, CRC. Compliance, CPCO. Practice management, CPPM. But CPC is the basic, because after learning CPC only you can go for the other courses. Okay, because CPC is the main certification where everyone is asking. And this is how the career progression is. Medical coding beginner, you will learn as a beginner, medical coding beginner. You are learning everything. Then you will do the examination, the certification for CPC, the entry level certification. Then you will become a medical coder, right? Okay. Then through your career, you will become a senior coder or QA, quality analyst, or you can become an auditor. From that, you can reach the coding manager position, coding manager, RCM manager, compliance, healthcare operations, anything. So this is how that your career will be progressing. Now, AAPC for a complete beginner. AAPC, professional education plus certification plus continuing development. CPC is a major starting credential for professional physician coding. Successful coding requires documentation knowledge, anatomy, ICD-10 CM, CPT, HICPICS, guidelines, and compliance awareness. Yeah, the same thing which I had told you earlier. The professional education. So first you have to gain the knowledge. You have to learn what is medical coding. You have to learn everything. Then do the certification. Get the continuing education points from AAPC. Become a membership. Okay. Become a membership. Then do the CEUs. Get the CEUs. Renew the membership every year. Otherwise your certification will become invalid. Okay. If you are not renewing AAPC, the renewal is for every year, but CEUs have to be gained every 2 years. Okay. So when you renew, if you are not renewing, your certification will become invalid. And the CEU points varies depends on the certification. Now, beginner roadmap. Start learning medical terminology and anatomy. Then you have to go and learn ICD-10 CM, CPT and HICPICS. Learn modifiers and guidelines. Practice real world cases. Prepare for the certification. Gain experience. Then you have to maintain the certification with AAPC, with CEUs. Okay. What are the major mistakes, common beginner mistakes? Choosing codes from memory only. As I told you earlier, these codes should not be memorized. Choosing codes only from memory is the basic mistake. Ignoring documentation. No, that is also another mistake. You have to read out the documentation carefully. Missing laterality. The laterality codes like left, right. Misusing modifiers. Ignoring exclude 1, exclude 2 notes. Not checking the medical necessity. Confusing professional versus facility coding. Assuming US coding rules are identical to UAE pair rules. That is for UAE payers. So these are the major beginner mistakes, the coding mistakes. Okay, that we will learn one by one. I will be teaching you one by one again and again from the basic level. If you go to my channel, you will get like 2 years before I had already started my channels. I mean my, the channel wise, chapter wise episodes I had mentioned. But since it's little old, I'll be, doing the practice questions in between for the those who are preparing for examination. Also, I'll do the learning chapter wise. I'll be teaching you. Okay. Key takeaway: AAPC is much more than CPC. AAPC doesn't mean only CPC. Okay, it is much more than CPC. It offers a career pathway across coding, billing, auditing, compliance, risk adjustment, and practice management. Everything will be covered, will be included under AAPC. For beginners, build strong fundamentals first, then choose a certification that matches your career goal. Same thing which I told you. You have to learn the basic fundamentals like anatomy, physiology, terminology, ICD codes, CPT codes, everything. Ethics, modifiers, the medical necessity, how to identify the documentation, everything, or how to extract the codes or services from the documentation. Everything you have to learn first, then choose your career accordingly. All right. So thank you, friends. Yeah, I forgot one thing. I'll show you this is the AAPC URL link, the link for AAPC. Okay, the link for AAPC. Here, when you click, you will be redirected to the AAPC website, where you can just go through that AAPC website, and you will be knowing what all things are included, what all certifications, or what are the things that you will get from AAPC, what all knowledge that you can get from AAPC, everything. You can go through this, then learn the basic fundamentals, learn the terminologies, learn everything, the basic things. Then you create a membership. When you are ready for your examination, you can take the membership. Okay, if you want to register for the exam, you have to definitely do the membership. You have to definitely take the membership first, then only you can register for the examination. Because once you take the membership, from that day it will be calculated for the next renewal. For example, if you are taking the membership today, then from today's date it will be calculated for the next year renewal. Every year there is renewal. Okay, and these are paid membership also. So that's it, friends. Thank you so much. I'll be coming back soon in the next episode, okay, regarding the CPC, the basics of CPT. All right. Thank you so much. If you find this video useful, please like and share it among your friends. All right, friends. So thank you so much, and see you in the next episode. Bye.